Okay, this time around, I wanted to talk a little bit about cervical cancer. And with that, I'm going to also talk about the pap smear. Um, now, in the old days, used to be people were recommended to get pap smear done every year, once a year. Um, um, and these days, there are some recommendations about getting a pap smear done every 2 years or every 3 years. The only comment I have to make on this, because I'm an older doctor, is that I know that there are pap smears that are not perfect. And I know if the pap smear is not perfect, the pathologist can read the pap smear and make a mistake. He may say that the pap is okay, but it actually is not okay. Um, the when they do a pap smear, what is done is basically that the cervix is scraped with an instrument. That material is put on a slide, and that is basically sent. Or the pap smear is done with a brush setup, which is put into a liquid, and that's sent to the pathologist. In both cases, the pathologist looks at the cells that are removed and determines whether the cells are normal or abnormal. With the abnormalities, usually what they're looking for is some change that represents a change of the cells towards cancer. Now, if I remember this. I haven't been doing pap smears late in my career, but there were used to be like 4 or 5 stages that you had on your pap smear, and if you had the last stage, it was basically cancer. Other stages were kind of like precancerous, or unknown significance. So if you got one that was unknown significance, usually the advice would be to repeat the pap smear, and then make sure that it came back normal again. There are things that can fool the pathologist. Certain medications, certain infections can cause abnormality in the cells that look just like precancerous changes. So if there was a very mild change in the cells, pathologists would put down unknown significance, and like I said, that would have to be repeated. Now, if there is definitely some changes in the cell that look like precancer, usually for my patients, I would refer them then to a gynecologist, because the next step would be something called a colposcopy, where they took a look at the cervix under a microscope and they did biopsies of any areas that looked abnormal. And basically, this way, they could try to determine whether that abnormality in the cell that looked precancerous was really okay, or whether it was really a cancer that was starting. So this, like I said, is called a colposcopy. A microscope is inserted inside the vagina. Biopsies are taken and sent to the pathologist. The pathologist reads it and tells the gynecologist what's the next step. If it is just precancerous changes, it's possible to treat the cervix, to remove the abnormal cells, and then a pap smear is done after a period of time to recheck. Because of all these steps that I'm talking about, cervical cancer can be a thing of the past as long as women do their pap smears. Um, we have things that can prevent cancer, tests that may be uncomfortable, may be embarrassing, but it's just a matter of get it done. We recommend everybody over the age of 50 to have a colonoscopy done. I've actually heard that some people are doing it as early as 40 or 45. Again, it's uncomfortable having an instrument put in the bottom area. I mean, having the enemas or whatever to clean yourself out, uncomfortable. Same thing with the pap smear. No woman wants a doctor to be putting instruments inside of her to do a pap smear, but it's a relatively simple test. Get it all over with. It's one way of determining whether there's any changes that might show that you have a risk for cervical cancer. Now, one thing about cervical cancer is that most cases of cervical cancer are caused by a wart virus. Now, it actually is not the wart that you may find on your finger. There are about 40 or 50 types of warts. Only about 4 of them are connected with cervical cancer. And so they've actually put a vaccine together with these 4 types. And it's recommended that young teens have this vaccine done so that they don't have to worry about picking up this virus that causes the warts to form. The warts are genital warts. They are spread person to person through relations. So we'd like to get the vaccine in as soon as possible so that we try to catch it before the person is sexually active. Once somebody is sexually active and they have this virus, most of the time the virus will be kicked out by the person's body's immune cell system. But in some cases, the virus continues on. And in that case, if it shows up on a pap smear, that person is considered precancerous until that virus is gone. So a woman who has the wart virus on her cervix has to go through multiple pap smears and multiple treatments because they're always going to be considered precancerous. In some cases, if things do not change and a woman isn't planning on having any more babies, the recommendation will be to have a hysterectomy to remove the cervix completely. Okay, so again, cervical cancer, is something, like I said, because of our knowledge about the causes, maybe a thing of the past, as long as women are agreeable to go for these pap smears. Okay, take care.